Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Begin with a clear boundary. Do not think of fruit as a cure for chronic fatigue. Think of it as a daily biological tool. Why does that distinction matter? Because chronic fatigue, especially when it resembles ME/CFS, is not ordinary tiredness. It can involve post-exertional worsening, sleep that does not restore, brain fog, pain, dizziness, gut symptoms, and a body that seems to crash after activities that once felt simple. The CDC emphasizes that there is no approved cure for ME/CFS, and that management must be individualized with pacing and symptom control at the center. So listen carefully. Fruit is not here to replace medical care, sleep management, pacing, or evaluation for anemia, thyroid disease, infection, autoimmune illness, depression, diabetes, medication effects, or sleep apnea. Fruit is here because the biology of fatigue gives us several doors, and fruit can gently knock on more than one of them. Now ask, why fruit? Why not just caffeine, sugar, or another supplement? Because fruit is not only natural sugar, that is the shallow interpretation. Whole fruit is a package. Water, fiber, potassium, vitamin C, folate, carotenoids, flavonoids, anthocyanins, organic acids, and hundreds of plant compounds that interact with digestion, blood vessels, immune signaling, oxidative stress, and the gut microbiome. The 2025-2030 Dietary Guidelines for Americans place fruits within a whole food eating pattern, while NICE guidance for ME/CFS specifically emphasizes adequate fluid intake and a well-balanced diet. That may sound simple, but in chronic fatigue, simple habits often matter because the body's margin for error is narrow. So today, use this frame. Fruit is not a magic switch. It is a daily set of small signals. How can small signals matter? They matter because fatigue often grows from many small burdens at once. Oxidative pressure, inflammatory signaling, blood sugar swings, low micronutrient intake, gut imbalance, dehydration, and reduced food variety. Remove one burden and the person may not transform overnight. Remove several, day after day, and the system may become less fragile. First, look at oxidative stress. Why is this important? Because fatigue is not only a feeling, it is also a cellular conversation. In ME/CFS research, reviews describe patterns involving oxidative and nitrosative stress, reduced antioxidant capacity, mitochondrial impairment, immune inflammatory pathways, and altered energy metabolism. Mitochondria are often described as the cell's power machinery, but do not oversimplify them. They are not batteries that simply need charging. They are living regulators of energy, inflammation, redox balance, and stress response. If the redox environment is disturbed, the body may feel as though ordinary effort costs too much. How can fruit help here? Choose deeply colored fruits: berries, cherries, black grapes, pomegranate, oranges, kiwi, mango, papaya, and apples with the peel. Why color? Because color often signals polyphenols and carotenoids. Anthocyanins give berries and cherries their dark red, purple, and blue tones. Flavonols appear in apples and grapes. Elagitannins are found in pomegranate and some berries. These compounds do not simply act like antioxidants in the old, simplistic sense. More importantly, they appear to influence cellular defense pathways, including antioxidant and inflammatory signaling networks such as NRF2 and NF-κB. In human nutrition literature, fruit polyphenols have been reviewed for anti-inflammatory effects, and dietary phytochemicals are repeatedly discussed as modulators of oxidative and inflammatory pathways. Now make it practical. Do not say, "I will eat fruit someday." Put fruit where fatigue decisions are weakest. Keep washed berries in the front of the refrigerator. Keep oranges or apples where you sit in the afternoon. Freeze mango, cherries, and mixed berries so preparation does not become a task. If fatigue steals your cooking energy, do not design a complicated plan. Design a low-friction plan. One fruit at breakfast, one fruit with lunch or as an afternoon snack, and one option ready for a bad day. Second, examine blood sugar stability. Why does this matter? Because many people with fatigue experience energy that rises briefly and then collapses. A candy bar, sweet drink, or pastry may feel like rescue, but it can create a sharper glucose rise and a sharper fall. Whole fruit behaves differently from fruit juice or refined sugar because its water and fiber slow the process. The instruction is simple. Choose whole fruit more often than juice. Eat the orange instead of drinking orange juice. Eat the apple instead of applesauce with added sugar. Eat berries with yogurt, nuts, oats, or eggs if you tolerate them. How does that help? Pairing fruit with protein or healthy fat slows gastric emptying and can make energy feel steadier. Be precise. Fruit contains sugar, yes, but whole fruit also contains structure. That structure is part of the medicine-like value of food. Do not strip it away unless chewing or digestion requires modification. If diabetes, reactive hypoglycemia, kidney disease, gastroparesis, severe IBS, or food intolerance is present, adjust with a clinician or dietitian. Use lower glycemic options such as berries, kiwi, apples, pears, citrus, and cherries and test your response. Do not guess when you can observe. Third, consider the gut. Ask, how can the gut influence fatigue? The answer is one of the most quietly important areas in ME/CFS research. Studies have found alterations in the gut microbiome of people with ME/CFS, including reduced capacity for butyrate production. Butyrate is a short-chain fatty acid produced when gut microbes ferment certain fibers. Why should you care about a molecule made in the colon? Because short-chain fatty acids help regulate the intestinal barrier, immune tone, and metabolic signaling. In other words, your fruit bowl may be feeding not only you, but also the microbial community that helps train your immune system. How do you apply this? Feed the microbiome gradually. Do not suddenly eat 6 pieces of fruit if your gut is sensitive. Start with 1 serving daily for a week. Then increase slowly. Use fruits with soluble fiber and pectin, apples, pears, citrus, berries, kiwi, and slightly green bananas if tolerated. If bloating appears, reduce the amount, peel the fruit temporarily, cook it lightly, or choose lower FOD/MAP options such as strawberries, blueberries, oranges, kiwi, pineapple, and firm bananas. Give this command to yourself. Increase variety before increasing volume. A small rotation of 3 or 4 tolerated fruits is often better than forcing a large quantity and triggering a gut crash. Fourth, think about micronutrients. Why can fruit matter even when calories are adequate? Because a person can eat enough calories and still have gaps in vitamin C, folate, potassium, magnesium, and plant compounds. Vitamin C deficiency is classically linked with scurvy, but before the dramatic signs appear, fatigue and irritability can occur. That does not mean every person with chronic fatigue has vitamin C deficiency. Do not make that leap. It means that low intake is a correctable burden, and fruit is one of the cleanest ways to correct it. Kiwi, citrus, strawberries, papaya, pineapple, and mango can raise vitamin C intake without requiring pills. How should you use this knowledge? Build a fatigue plate. Put 1 vitamin C fruit on it each day. Add 1 dark-colored fruit most days. Add 1 potassium-rich fruit when appropriate. Banana, orange, melon, kiwi, or dried apricot in small amounts. But be careful. If kidney disease is present, potassium must be individualized. If medications affect potassium balance, ask before increasing high potassium foods. Professional advice is not a barrier. It is protection. Fifth, look at clinical signals from food-based research. A randomized, double-blind, placebo-controlled trial tested a pomegranate extract combined with B vitamins and vitamin C in adults with mild prolonged fatigue. After 2 months, fatigue severity scores decreased more in the supplemented group, although biochemical markers did not significantly change. What should we learn from that? Do not overstate it. It was not a trial proving that pomegranate cures ME/CFS, but do not ignore it either. It suggests that fruit-derived polyphenols, especially when combined with water-soluble vitamins involved in energy metabolism, may influence the experience of fatigue in some people. This is where discipline matters. Do not chase exotic powders before mastering ordinary fruit. Pomegranate arils, berries, grapes, citrus, kiwi, cherries, and apples are not glamorous interventions, but the body often responds to repeated basics. Ask yourself, what is more useful? A perfect supplement taken for 3 days, or a tolerable fruit pattern repeated for 3 months? Sixth, protect pacing. Why mention pacing in a talk about fruit? Because people with chronic fatigue often feel a small improvement and then spend it all. Do not do that. If fruit improves hydration, digestion, or afternoon steadiness, do not use the extra clarity to overexert. Use it to stabilize the day. The CDC warns that people with ME/CFS can worsen after activity and may need to stay within an individual energy envelope. So make this rule: nutrition supports pacing. It does not replace pacing. If you feel 10% better, spend 5% and save 5%. Now create a daily protocol. In the morning, take 1 fruit with breakfast, berries with oats, kiwi with yogurt, or an orange with eggs. Why morning? Because it begins the day with fluid, fiber, and micronutrients instead of waiting for a crash. At midday, add a second fruit if tolerated, apple slices with peanut butter, grapes with cheese, or pear with nuts. Why pair it? Because pairing steadies absorption. In the late afternoon, when the body asks for sugar, choose a controlled fruit option: frozen berries blended with plain yogurt, cherries with walnuts, or citrus with a protein snack. How do you know it works? Track 3 things for 2 weeks: energy, steadiness, digestive response, and post-exertional symptoms. Keep the plan that lowers volatility. Remove what worsens bloating, glucose swings, migraines, reflux, or histamine-type symptoms. Also, choose forms wisely. Fresh fruit is excellent. Frozen fruit is excellent. Unsweetened canned fruit can work when energy and budget are tight. Dried fruit is concentrated, so use small portions. Juice is the least helpful for most fatigue patterns because it removes much of the fiber and makes sugar easier to overconsume. Smoothies can be useful, but build them correctly. Whole fruit, protein, and fat. Do not make a giant fruit sugar drink and call it health. Finally, respect individual biology. A systematic review of dietary and nutrition interventions for CFS/ME found that evidence for specific dietary treatments remains limited, and that supplementation or restriction should be guided by identified needs, intolerances, or deficiencies. That is exactly why fruit is best presented as a supportive foundation, not a universal treatment claim. Use it carefully, personalize it, measure response, keep the door open to medical evaluation. So, why can fruit be beneficial in chronic fatigue? Because it addresses several low-level burdens at once: oxidative stress, inflammatory signaling, gut microbial metabolism, hydration, micronutrient density, and blood sugar stability. How can it be effective? By being whole, colorful, repeated, paired wisely, and adjusted to tolerance. Do this starting tomorrow. Choose 2 whole fruits, preferably 2 different colors. Pair at least 1 with protein or fat. Avoid using juice as your main fruit source. Track your response for 14 days. If your gut is sensitive, start smaller. If you have diabetes, kidney disease, major food intolerance, or complex medications, ask for guidance. And most importantly, do not use better nutrition as permission to push past your limits. Remember this line: Fruit does not force the tired body, it supports the tired body. It does not shout at the system, it speaks in daily biochemical whispers. And for many people living with chronic fatigue, that gentle consistency may be exactly the kind of support the body can accept. Take care of yourselves, take care of each other, and let's keep learning as one community. See you in the next topic.